Mr. Chakravarti, I found to be very professional and knowledgeable. He was clearly on top of his subject. He knew all about the operation that I was wanting to talk to him about. He was very calm and reassuring. And after I spent 30 minutes with him at my initial consultation, I was certain he was the right man who would be able to help me and sort out my medical problems. Um, I'd done some research before I went to see him, and he was obviously very experienced in the area that I was looking for some help. Well, it was called a HoLEP operation. It was on my prostate. The full title of the operation is Holmium laser enucleation of the prostate. So basically, I had an enlarged prostate that weighed over 200 grams, and that was preventing me from passing urine. So I was having to have a bag and a catheter at the time. So this operation was to resolve that problem. Right. Well, during the initial consultation, Mr. Chakravarti listened very carefully to the history of what had happened over the previous few months to me, and then he sort of read my notes as well. So before he sort of started talking, he did, he listened carefully to what my problems were, and then he explained that a whole operation was the right one for me. He then carefully explained what the operation would involve, how he would do it, how long it would take. And then he then went on to carefully explain the potential side effects, or if any, or the risks rather than side effects, the risks of having this particular procedure. He talked then about how long I would be in hospital for. I mean, what he did do, because I was travelling some distance to the hospital, I would have normally been in hospital for 2 nights, but he was keen to make sure everything was all okay before I was released from hospital. I stayed in for 3 nights, which again found to be very reassuring. Well, it went fantastically well. I saw Mr. Chakravarti. He came to see me before the operation, when I'd registered in the hospital, and he went through again the things that he talked about and checked if I was okay, and generally reassured me and calmed me, because obviously I was a bit anxious before the operation. So I felt, having met him at the consultation and then met him again in hospital, I was really reassured, because he's a man with a very calm nature, and he's a very reassuring man to be looking after you. So I was in hospital for the 3 nights, and then I left as planned on the on the Sunday. I had the operation on the Thursday, and I was discharged from the hospital on the Sunday. The procedure went extremely well, because it was a laser treatment and there was no wound or anything like that. I had no pain after the operation, which was fantastic. And to leave hospital without the catheter and the bag was just fantastic. It was just wonderful. Well, the recovery went extremely well. I was a bit tired for the first week or so after the procedure, but within 2 weeks I was back driving and leading a fairly normal life. Now, I'm someone who leads an active life, and I go to the gym, and I also run and enjoy walking. So with that, I had to sort of put that on hold for a few weeks. I went to see the physiotherapist at the beginning of December, which was 5 or 6 weeks after my operation, and I got the green light to resume, physical activity. And I'm now back at the gym, running and and leading a normal life again, an active life. So it's just been, the recovery's just gone so well. It couldn't have gone better. Oh goodness me, yeah, it's been fantastic. I've got my life back. Having a catheter and a bag, and it puts such a restriction on your life, and it sort of makes you feel very sort of down in the dumps and not very happy. So, Mr. Chakravarti couldn't have done a better job for me. Um, it's just wonderful, and I've registered for the Wakefield Hospice 10K. That's next month, so I'm hoping to do that, and that'll be sort of within 21 weeks of the operation. I'm back running a 10K, which is great. So, and the other big plus is having this operation. I don't have to take any medication. So medication, which potentially might have a side effect and cause other problems, I don't have to take any medication, and I just need to have my PSA levels checked annually. So, I consider it money very well spent. And I would certainly recommend him to anybody who's in the same situation that I was, and I'd happily speak to anybody, and reassure them that it's you know he's a man to be trusted. Oh man, you can put your trust in, and I thoroughly recommend him.